If you can see that, Mike, I can barely see it. Let me know when we're live. I'm looking
Mr. Chairman,
plexiglass. It's hard to see.
Mr. Chairman, you're live on YouTube.
Very good. Thank you very much. Labor and Health will come to order. Mike, go ahead and take the roll, please.
Senator Bouchard,
Excused.
Senator Furphy,
Here.
Senator Hutchings, Senator McCune,
Here.
Chairman Baldwin.
Here.
Thank you. 4 present, 1 excused.
Thank you very much, Mike. Welcome to all the audience. This is flight number 10. If you're on the wrong flight, we're going to Jamaica. So you may be going the wrong place, but you'll have twice as much fun on this flight. We have 2 bills before us today. We're going to try to get through them both in good order. We probably have a lot of online testimony as well as what we have in the room. So let's get started. First one we will hear is Senate File 80, Public Health Orders, Local and Legislative Oversight. Sponsor is our own Senator McEwen. So we will have him jump down here in the testimony chair in front of us, take the spotlight, and present that bill to us. Senator McEwen. I can almost see you through the plexiglass, Senator McEwen. Proceed.
Morning, Mr. Chairman.
Light up your mic there for us when the green light comes on.
I think it is on.
Perfect.
There we go. Morning, Mr. Chairman. Senator McEwen, I'm bringing forth Senate File 80. It's basically the public health order. The title of the bill is Public Health Orders, Limitations, Local Oversight, and Ratification. The main focus of this bill is to take the power out of the governor, the executive branch, move it into the legislative branch, and push it on further down to the county commissioners and city as need be. The first part of the bill basically says no public health order can be issued from the executive branch for a period exceeding 30 days. And if it needs to go on 30 days, we have to convene the legislature and it has to be ratified. The next part of the bill basically outlines the fact that you can't game the system and line 2 30-dayers up in a row before the other one expires. Public health orders by county, municipal, and district health officers. Basically, we're putting a limitation on them for 15 days. And in both cases, neither of these orders can go into effect for 48 hours. The next language is basically the same, only 15 days for those applicable agencies. And once again, on the 13th day, you're not able to pop up another 15-day health order without ratification from the legislation. The important part on this, let me get to it. Is that we're really putting some power back into the local government's hands. And there's some language in here that, sorry, it's the first time. There's some language in here. The really important part is the communication part of it between the legislature and the county commissions and city public health officers to work together. It's really pretty simple. And with that, I'll stand for questions.
You did a great job, Senator McEwen. And it's good talking to the people behind you because you don't know what their facial expressions are. I don't either. They've got masks on. So committee, do you have any questions for Senator McEwen? Go ahead. Senator Furphy, go ahead, please.
Thank you, Mr. Chairman. let me ask about, I'm concerned if we have issues that come up very rapidly, such as a flood, and the governor needs to deal with the health issues that the flood creates. I'm concerned that we would be withholding his ability to meet those requirements immediately. So I would appreciate your comments on that issue, where the governor and the health officer need to take immediate action to solve a big problem. Thank you.
Mr. Chairman,
Senator McEwen.
basically, this bill would give them that ability immediately. But it basically ends after 30 days without being ratified by the legislature. So if there is a big emergency up front, they have the ability to do it. And the reason we chose 30 days is that's enough time to convene the legislature. It's enough time to kind of feel our way through the problem and see where we're at.
Thank you. Further questions, committee? You may have to throw something at me and get my attention because you're hard to see. No further questions? Okay, Senator McEwen, you can come back up here. We'll let the public weigh in here. Do we have any members from any departments, state departments? I don't see anybody. I see lots of other people.
Mr. Chairman, we have
Go
a
ahead.
representative. Mr. Chairman, we have a representative from the governor's office on Zoom.
Great, let's go ahead and put them in. I see a face, but I can't read the name. So go ahead, sir, and introduce yourself and address the committee.
Thank you. Mr. Chairman, my name is Rennie McKay. I'm Governor Mark Gordon's Policy Director. So really appreciate your time, Mr. Chairman, and your committee's time to just take a few quick comments. Appreciate that you are taking a look, and I imagine there'll be many more discussions here as the session goes on about this public health emergency and crisis that we're facing right now. And I just wanted to let you know, we sure appreciate these conversations, and that's why the governor's office is supporting Senate File 30 at this time, is that we think that once we can move through this crisis, there is a time to look back and make changes as needed across the board. And the governor's office is planning an after action review. The Department of Health is planning after action reviews as it does whenever there are these large scale events, both in Wyoming, and also they take a look at their policies and their approach when other pandemics happen. And Wyoming has a pandemic response plan, and that was updated after the H1N1 flu as a virus, as an example. So again, just want to thank you for that. I think there are some issues that we just want to make sure that are considered, and that's why we think the after action review with that task force that Senate File 30 would set up is really helpful, because there can definitely be some second order effects as we look at the health orders and that statute 351240, because that's used in many non-pandemic instances as well. So as Senator Murphy just pointed out, we want to just make sure that this is done thoughtfully, so we do come out of this stronger and can approach any future pandemics as strongly as possible, so we can keep people safe and also keep people's livelihoods safe. So, Mr. Chairman, thank you for your time, and if there's any questions, I'm here for you, but I just wanted to let you know that we're thinking about this topic as well, and planning an after action review, and we'll be looking at our policies and approach and looking to see how we could have done things better, and we definitely support and will participate in any after action review that the legislature initiates.
Thank you very much. Question, committees? No questions? Thank you very much.
Thank you.
Any further agencies in the waiting room? Nobody
No,
here?
Mr. Chairman.
Very
that's
good.
it.
Let's do in-room comment. If we may, go ahead, County Commissioners, you look like you're anxious to jump up here. Introduce yourself and tell us a good joke.
Mr. Chairman, for the good jokes, you have to get my wife. I'm not the guy for that. Mr. Chairman, members of the committee, I am Jeremiah Riemann here on behalf of Wyoming's County Commissioners. In the room with me today is Mr. Bill Novotny, who's the chairman of the Johnson County Commission. He also happens to serve as our association vice president. Also joined by Mr. Lee Livingston, who is a Park County Commissioner. Mr. Chairman, appreciate the opportunity to address this issue. I thought I might start with just my own personal experience through this pandemic. When this really became an issue for my members, we immediately acted. Thought this was the opportunity for us to really bring together our commissioners and ensure that they could communicate with one another and talk about their experiences and what was happening at the ground level. What were the issues with state agencies, even federal agencies? What were they hearing in their communities and what did they need to do? We stood up daily calls immediately. We invited our congressional delegation, and I'm pretty darn proud that members of our congressional delegation joined that call every day, and not their staff, the actual members. They continue to do that to this day. We do those calls weekly at this point in time so that we can continue to connect our members. We also had participation from the governor's office. Mr. McKay has participated in every one of those briefings with us to ensure that we were connected and coordinated. We've also had the Departments of Health and Homeland Security there to talk us through what was happening. Did it work every time? No. There were hiccups. There were frustrations. It gave us a venue for us to talk about that. Mr. Chairman, the reason I bring that up is because it gave me a front row seat to what the commissioners were dealing with in their particular areas. And what I saw is 23 different experiences. Some had really productive relationships with county health officers and what was going on in their community. Others didn't have such productive conversations. You've seen some of that in the newspapers, perhaps, and what resulted from that. Mr. Chairman, some of my members want some of these powers that are represented in this bill and perhaps some of the other bills that are before you. Others don't want those powers because they don't consider themselves public health officers. They really think that that responsibility should reside elsewhere. It's not uniform across the state. It is something different in every communication or in every county. What is pretty clear to me is that communication matters in this conversation. Those that have had good experiences have had daily conversations with their public health officers. I've got one county who will tell you that they never got a call from their public health officer. And as a result, that individual is no longer a county health officer. And that's unfortunate that we had that sort of a situation. Mr. Chairman, my members, commissioners across the state were pretty resolute when we discussed this and many of the other bills in the fact that something needs to change. But they think a more comprehensive review needs to happen. And that's why they support Senate File 30 as their preferred venue for considering all of the changes that are necessary, not just minute changes that might come through some of these pieces of legislation. And so we will support that. We didn't take a position of opposition or support for this and some of the other bills. We preferred to monitor them and walk through the process and let you know that Senate File 30 was our preferred venue. I think it allows for a more comprehensive review and in particular, what's necessary action for change. So Mr. Chairman, with that, I'd stand for any questions. If you'd like to hear from the commissioners, they're certainly here and available.
Let's invite those other two commissioners up to the table. They look like they want to get up there. They're very comfortable chairs, gentlemen. Let's go ahead and hear from these two gentlemen first, and then we'll address questions to all three of you. If you introduce yourself, Commissioner Novotny.
Good morning, Mr. Chairman, members of the committee, Bill Novotny, Johnson County Commissioner. Our county actually enjoyed some of the largest number of variances and exemptions to the health orders that were in place. Overall, we've had a very successful vaccination program. We did have the first COVID death in the state, an individual that had some serious comorbidities that maybe didn't make COVID the underlying factor of his death. But we have enjoyed a good working relationship with our county health officer, although at times it was a tense relationship. And we were oftentimes put in a situation where you had members of the public saying that if you didn't do more, you had blood on your hands. If you didn't immediately release everything, then also you were a derelict in your duty. So you were in a position that really is not the most desirable, but certainly we work to balance public health and also make sure that the residents of our community were safe.
Very good. Commissioner Livingston.
Good morning, Chairman Baldwin, members of the committee. I would echo some of what Commissioner Novotny said. I'm Lee Livingston, Park County Commissioner. We had an excellent relationship with our health officer, Dr. Aaron Billen. He was very knowledgeable. He brought a lot of information to us. Again, we didn't always agree. When he asked for a public a mask mandate for Park County, I urged him to not make it a mandate. I felt it would probably put less masks on. He respectfully disagreed and ordered the mandate, and we actually saw an increase in mask usage. But he was in keeping us informed all the way along the line. And I'm not too sure I want to be, in charge of making health decisions. I can guide you to a big elk, but I probably wouldn't be the one you want to come to for health decisions. And again, Dr. Billen was great to work with and very knowledgeable, and he was flexible. He would listen to us, and he did submit some variances that allowed some pretty big things to happen in Park County. And again, he was very receptive. I would prefer to see the pandemic task force move forward and address everything instead of trying to piecemeal it through, one piece at a time. And that's kind of where we're at right now. Thank you.
Thank you, Commissioner. Committee questions for the Commissioner Group. Senator Furphy.
Thank you, Mr. Chairman. Let me ask if you have concerns about this bill, the way it's written. First of all, the state has to allow 48 hours before it can issue a health order. And again, I'm talking about an immediate problem, such as a flood or something that could immediately impact health of counties, the state, et cetera. And it also said the county health officer can't issue any order without taking time to provide public input before they issue that. Is that a concern to you? Thank you.
Whoever wants to address that. Looks like. Go ahead, Mr. Raymond. You got elected.
Sure, Mr. Chairman, Senator Furphy. Certainly not being able to respond in an adequate time is of concern and would be for, I think, all of my members. I think it is appropriate that when the time is right, we have the power to act. Senator, just going a little bit further, though, some of my members would like perhaps some form, I'm not going to say it's this exact form of the powers that might be represented in this bill. And again, others will not. And I just, again, go to that 23 different experiences have happened across this state. And so that's why we, again, support looking at this more comprehensively through Senate File 30.
Thank you. Follow up, Senator Furphy? Nope. Senator Richard.
Thank you, Mr. Chairman. So we're talking about floods and we're talking about things that, I mean, kind of are far away from a health officer. So my concern is I'm still getting texts on, I mean, I don't know if you're aware, but early treatment has been my issue. I was out in front of the Capitol months ago into this thing, talking about vitamin D, and people scoffed at me. And we didn't hear anything out from the health officers. And then more recently, you see this stuff in the news, how they figured out that, yeah, people that have adequate vitamin D are fine. I'm having a problem here that we've got health orders, but yet we didn't have anybody saying, hey, how do we treat this? And then we know we have doctors because I have one that I refer people to. So we got something under 1% of the doctors know what's going on. We got health officers that don't know what's going on. That's where I'm seeing the problem here. So what I see this as reining them in and making sure they don't take too big a bite, and they should be focusing on the health, not necessarily just on what mainstream media is pushing as the agenda, because they politicized a drug and health officers just jumped right on board with it instead of saying, wait a minute. I mean, and most of you probably don't know, my daughter had a problem where they used hydroxychloroquine in 2017. That's why I knew it worked on a cytokine storm. So I expect more from people in this position. We're having this bill here because they got too much power. So are you not hearing any of the same things from your people? I mean, we've got some doctors that treat, some that just say, stay home and die. So I'm trying to figure out how we get balance here. And I want to know if you've heard from the same thing from any of your constituents.
Thanks, Senator Bouchard. Senator Novotny. You want to be a senator today? Commissioner Novotny, go ahead.
Mr. Chairman, Senator Bouchard, we have heard the gamut of things, and you have to remember that most of our county health officers are family medical practitioners. My own county health officer also serves on the local hospital board and is the ambulance director. And so infectious diseases and treatment plans that deal with things that come through the hospital, probably, yes, you could say he is an absolute expert on those. On other things, he's probably going to go to the medical journals and the best available information. But certainly we heard all sorts of things. And you're right, there certainly is a level of issue when you place completely different things. And in my own community, we've dealt with major flooding issues that created health emergencies that had nothing to do with the scenario that we're facing under COVID-19. And when you lump things like that under one section of the law, certainly you do run into some questions where, is there too much authority? And absolutely, if we are going to address concerns like the one that you just brought up, absolutely, that's why we would advance this task force where you can have members of the medical community, members of the commissioners who are actually dealing with this situation, as well as county health officers. And so we can come up with comprehensive reform that protects rights and protects public health.
No follow-up? Follow-up, Senator Bouchard.
Thank you, Mr. Chairman. Look, I think I'm just like the general public where I don't trust the experts anymore. I've got a doctor that I call and I refer people to, and that he saved lives. I talked to the health officer, the state health officer, And all I got was the standard CNN answer that these drugs don't work and we're going to listen to what the CDC says. That's kind of the direction I'm seeing here, is the people at the top just look at the people above them. So, I mean, we need thinkers in here. And if we don't have thinkers, then we got to have limitations. That's all I'm saying. So, I mean, aren't you hearing that from your constituents as well?
Thank you, Senator, or Commissioner Novotny.
Senator Baldwin. Senator Bouchard, let me tell you who some of the best thinkers are. And those are your county commissioners who are on the ground every day dealing with a myriad of issues. You know, I'm not going to debate with you the medical credentials of whoever is appointed the state health officer. What I will encourage this body to do is move forward the bill that will allow us to have a broader educational level in our local health officers. Many of our counties don't have the number of medical professionals that are able and willing to even serve as a county health officer. So if you look at adding advanced practice nurses to the group of people that we can call on in our community to serve as county health officers, that will help us solve problems and not make talking points, because commissioners are about solving problems, because we are where the rubber hits the road.
Thank you. Further questions? Senator McEwen.
Just like to point out a couple things. We had all the experts together. How long's COVID-19 been going on for? A year? We hung our hat on a law that was passed in the 1800s. We violated our own state constitution so we could get all the experts together. And if you look at paragraph B, it gives the county commissioners the opportunity to opt out. This is your choice. If you want to be involved, be involved. If you want to go through the health officer, go through the health officer. I'm trying to provide you an avenue to affect, as you said, 23 different scenarios. And I don't want a behemoth bill that is so overarching and so well defining that we destroy the intent of everything by telling everybody what they have to do, when they have to do it, because some doctor or public health officer said. And you are absolutely right. You are where the rubber meets the road. And this bill gives you the ability to decide how much tire you want on the road. All of it, none of it. And it depends on what county you're from. And like you said, every situation's different. So I don't think forming a task force to develop a one-size-fits-all bill is the answer.
I bet there was a question in there somewhere. Say, don't you agree, gentlemen?
Don't you agree, gentlemen?
Would anybody like to answer that or reply to that? Mr. Ryman.
Mr. Chairman, Senator McEwen, again, some of my members want the powers that you're offering in this bill. I'm not here to debate that. Others don't want that. The approach that the commissioners as a whole, and just to be really clear, takes 70% of my members to establish a position. We don't just go 51%. We're serious about the way we approach this. And my members felt it was more appropriate to take that balance, try and find the appropriate solutions. It doesn't have to be a behemoth bill. It could be razor thin at the issues we need to address here. And they're more broad than giving commissioners powers to, do away with public health orders. It's about looking at whether we need to have different individuals and capabilities sitting in these seats to make these decisions. It's about what is the role of commissioners in communicating with the public health officers and what veto authorities they might have. So my members elected to put their focus on that comprehensive review rather than this bill and many of the others that are being brought forward.
Thank you. Senator Hutchins, did you have a question?
I did, Mr. Chairman, and Senator McEwen kind of touched on some of those. When I heard Mr. Novotny say that the county commissioners are some of the best thinkers. And then I was thinking about the bill as well, where we asked the public to get together, barring floods and dealing only with this pandemic and the health officials. I think that is a wide range of thinkers getting together and getting input in to help those who don't want to do this or may feel inadequate to do this. It'll help them out. I like the bill. I know if we need to, we can probably amend some things in it if necessary, but I think this is the best move forward. And one of the things that we have to keep in mind is just because you like a particular bill, that bill may not pass. And if we lay this one back, then we have nothing. So we have to advance in some way. I do appreciate you gentlemen coming here and giving us your side of the story, but I think it's so important for all of us to get together during times like this. So thank you very much.
And there was a question in there somewhere.
There was, well, actually, you asked me if I had a question and I kind of told you he answered it, and then I thought it would be nice because they're so handsome.
Don't you agree, gentlemen?
It came from so far.
Mr. Chairman, if I could
Go ahead,
respond to Senator Hutchings, I really do appreciate that thought there, and that is what we're looking at. And I want to be really clear. I didn't come here to oppose this bill. That's not a position that we've established on this. If the body feels it needs to move forward, we'll continue to evaluate it and participate in the process. I'm just simply saying that as our favorable option, Senate File 30 is that vehicle.
Thank you, gentlemen. And we do appreciate our county commissioners. I know I represent 4 counties and they're all over the board. One county is I've got a contact with every single day. I know how many cases are in that county, et cetera, et cetera. Another county I've heard from twice in a year. So they are all over the board. You're correct. But thank you very much for coming to see us today. You're always welcome in Labor and Health.
Thank you.
Other members in the room who wish to comment. Mr. Moline, step right up, please.
Brett Moline, Wyoming Farm Bureau Federation. I'm sitting in support of this bill. To me, it gives you, the legislators, a couple of options. That one thing with this bill, it goes into effect before the task force is organized. That's the downfall of a task force, is it does push that decision down the road. And so having this more local control fits with my members' policy of having, typically the best government is the government closest to the people. So having this option for the commissioners, it will be different in every county. Some opt in, some opt out. That gives them the option. But again, it does go into effect now or relatively quickly, where the task force will be at least a year, if not 2 years out. And with that, Mr. Chairman, I tried to be brief and I will sit for any questions.
Committee, if you remember last time Mr. Moline presented, I commented on how brief he was and I'd never seen that before. I stand corrected. Any questions from the committee to Mr. Moline? Senator Hutchings, you're getting ready to push a button. Do you want to comment?
I want to comment, but I don't know if I'll have a question. I'll try to
Just
fit
ask
it
him.
in.
Just ask him if he agrees when you.
Thank you, Mr. Chairman. One of the things I liked about what you said is the task force is going to be long-term, and this bill goes into effect right away. Another thing I'm finding is I have had two people oppose this bill, and just floods of people saying they want Senate File 80. I'm just hearing about Senate File 30 within the last 24 hours. So I thank you. And I agree with you on your task force long-term. And I'm trying to figure out how to put a question in there. Do you agree with what I'm saying?
Mr. Moline.
Mr. Chairman, I've got 6 older brothers. I'm married and have 2 kids. I realize the right thing would be to say is, yes, ma'am.
Thank you, sir.
In the record, we got that. Any further questions, committee, for Mr. Moline? No further questions. Thank you very much.
Mr. Chairman, committee, thank you for this opportunity.
Further comments in the room? Don't be shy, jump right up.
Morning, committee. Thank you for the opportunity to testify. My name is Marguerite Herman, and I'm here to bring the perspective of the school district. I'm a trustee at Laramie County District 1. And some of it is going to kind of reflect the dilemmas facing county commissioners. But what I can say is that I also favor the Senate File 30. And what I see is detrimental to us specifically of the process described in Senate File 80 is that it involves running basically health issues, health and science, evidence-based decisions through a political process. And as we faced opening, the decision whether to have face-to-face, like everyone else in the state, we just shut down our schools last spring because we were caught off guard. We didn't have a plan B ready. So we had all summer to plan, and we relied heavily on our city county health officer to give us guidelines to open safely. And I can tell you, we got similar to what you heard from the county commissioners. We had, especially teachers, understandably, were scared to death to come back face to face. And because they had sick people at home, they were afraid of catching the virus in that environment, taking it home. So it wasn't just them. And parents were fearful too. On the other hand, we had a lot of people saying, open it, I don't want to wear a mask. And basically the three things that we put in place were with the mask, distancing, and really rigorous cleaning. And you wouldn't believe the extent to COVID. I mean, we followed every health order to the T. And we said, we think we have faith in the process, faith in the science, faith in, and as far as treatment, what we relied on was the expertise in the transmission, the latest science about the transmission of the virus, which has developed over time because that's what science does. And so we had, we had people on both sides, and we were able to set up a virtual school for the people who were just too afraid to come in to school. Or the people who said, I will refuse to wear a mask, said, well, that's fine, and stay home, we have a virtual school. So we were able to deal with that. But I guess what I can say is that what allowed us to stay face-to-face 5 days a week, and there are some districts who have only been face-to-face 2 days a week, but we've done that. And you've heard all the benefits of face-to-face instruction, social, emotional, the academic, and the sports we've been able to do because we follow our health orders about how many people how densely to pack our athletic events. And I'll tell you, not only have we had a very successful year, we don't have transmission in school. Our schools are the safest place to be in town, I can tell you, because we're doing that and we're able to stay open because we had these orders. And what made them, I think, enforceable is the fact that we could rely on them implicitly. No pressure to cut corners, to pull punches. What does the science say? And we're going to do that. And I think that gave our teachers and parents the confidence they needed to say, okay, we'll send our kids to school, or okay, I'll continue teaching. There were teachers who were very fearful for good reason. But the fact that we stuck with the science, the evidence-based orders, and the teachers and everyone could rely on it. I have to say that running it through a legislative process, I don't know how much confidence we would have been able to draw upon in that circumstance. So I know all this is kind of working around the edges, but it all gets me to I think Senate File 30 is a better approach, so that schools we have an authority we can rely on implicitly.
Thank you. I would caution the committee. We've had a lot of talk about Senate File 30, and it will stand on its own merit. We're going to be bringing it up. So we'll leave that to its own day. Right now, we need to discuss Senate File 80. Senator McEwen, go ahead, sir.
So my first comment or question is, and I have two questions. Would you believe that what happened was unconstitutional? Question number one. Question number two, when we turn this over to another government agency other than this one, it's all political. And don't fool yourself. We ended up with boys wrestling on a mat slobbering all over each other and bleeding on each other. And then when it was finished, we wouldn't let them shake hands. And you want me to believe these people are going to inspire confidence? Do you think that meets the test of common sense?
Mr. Chairman,
Go ahead.
I'm going to sit here and say we followed all the health orders to a T, and we have been able to to prevent transmission in our schools and actually in our athletics as well. And we're all, I guess, kind of critics of the orders. And I'm not a scientist, and and people have mentioned, why can't we pack the stadiums, because we have 10 family members who want to watch our daughter play basketball, and we have these orders that we can stand by with confidence, and we stick to, and that allows us to keep our schools open. And in fact, in the wrestling, I know we just went through regionals here in Cheyenne, and we'll see with the transmission rate. I don't know, I'm not privy to what went on as far as screening the students and that sort of thing. All I can say is what we did worked, and it's kept our students safe, which is that is one of our highest callings, and it's been able to let us do that, sports and academics.
Follow up, Senator McEwen.
I think we're making an assumption that what we did actually contained the virus.
Yeah.
I don't think we've defined that. I don't think we know about that. The other thing, we sit in this room as government employees. This had no effect on us. We had to teach at home. We still got a paycheck. We protected students. We still got a full paycheck. And there's businesses going under left and right, and nobody's looking out for them. We took CARES Act money. We paid teachers with PPP. My point is, it's time for us to get involved, and we could invent task force all day long. We can find ways to push the responsibility further away from us, but we're not getting anywhere. We're in a room talking about wrestlers who can't shake hands, and we want the people who came up with those rules to come up with more rules just like that and declare victory. At the end of the day, if we all get in a bubble, because a health officer said so, it'll work. The economy will be shut down and nobody will be doing anything, and it won't be much of a life for anybody. And if you watch now, I hear 3 masks are better than 1. So my problem with the task force and a lot of things you're going to see is the constitutionality of all this. We violated Article 1, Section 38, which makes the law reprehensible and unenforceable. So we have to do something to get back to the Constitution and find some legislation that works. And don't assume that in the Senate, we just sit around and think we're doctors. We talk to people just like everybody else does, and we care about students, and we care about our constituents. So I'm just asking to answer those 2 questions.
Further
Mr.
comment, go
Chairman,
ahead.
So just briefly, one thing that we can point to is the community rate of transmission and the rate of transmission in the schools. So I can say that while cases were being passed around in the community, they were not in the school system. And the cases that we found in the school system came from the community. So I guess, if you can use that as comparing, comparing the people who lived in the community and certain environments, it was transmitted and certain not. And I think it's because of what we did. I guess we can debate that it may have been just luck or something else, but I think what the orders that we followed were effective. And that I would just assume that the orders be based on the latest and greatest science, and and if there is a way to review that and question that and test it, I would hope that this other task force thing would show that up. if any orders were ill-advised, if they were not based on reason, if they were draconian and that sort of thing. All I can say is that I want my schools to be driven, or our protocols to be set by what the latest science is on the transmission, because that's what we were trying to do, is control transmission. We're trying to cure, treat, whatever. It's all about transmission. And now that vaccinations are being made, that landscape may change once again. But that's all I'm saying is that, and if there are things we could have done better, I think a deliberate look back will be helpful in that.
Thank you. Further questions, Senator Burchard?
Thank you, Mr. Chairman. So I heard the word science, and then I heard the word assume. And look, I met with parents in District 2, and a lot of talk over there, much different than what is probably you're in District 1, correct?
Correct.
We looked at the science. If you go look at the first epicenter of where everything happened in New York, the data shows that under 18 years old, 0. Yeah, that data is there. And we know that children aren't the ones that are the major risk because their immune systems react differently. So to just assume that we stuck masks on kids and somehow that made a difference, I don't see there's definite science there. Because we also know the science says that if we put all those chemicals, and some of those chemicals are bad chemicals, because I know for a fact they've left some of the chairs wet with some of those chemicals where kids could get that on their skin. And we create an environment where their immune system actually gets weaker because they're not being challenged. And so I'm looking at all this as anecdotal because we're not looking at real science. We're just assuming that somebody at the top, like Dr. Fauci, told us to wear 3 masks now, and that works. I mean, I'm just, so have you looked at the actual data at the epicenter and to see these children that were not there? Have you seen this data? I mean, how can we talk about science if we're not looking at real data?
And
Go ahead.
Mr. Chairman, I would suggest that we look at current data, not data that's 12 months old. I would have to say that we're learning, the virologists are learning things daily about the nature of the virus and its mutations and how it's transmitted. And some variants are more easily transmitted than others. And that's, once again, is about how it's transmitted, if people can be asymptomatic and be carriers and shedders. I mean, it's a lot more complicated than what we first thought about in New Rochelle, New York in last March. And so I'm suggesting that we move with the science. And science is always being proved in the sense of being tested. Going back on my days from science projects, you have a hypothesis and the hypothesis is never proved, and so I guess, without getting off the rails too far here, I would have to say that, first of all, I would say I'll have the temerity to disagree with some of the things you've said, some of the propositions, but all I can say is that the fact that we were successful this year, and we're going to have athletics, and we're going to have in-person learning, and we're going to have graduations, is because we are observing, we are obeying the protocol set by health officers who were dealing with the best science they had at the time. And again, that's what science does. It evolves with research, with evidence, and that sort of thing. And that I would just assume, I would hope that our ability to do that and secure the confidence of our stakeholders relies on it being from that source. But again, if a look back at task force says finds fault with that system, I'll pay attention. I would just rather soon take that route than this.
Thank you. Before further committee comments, I want to preface this with, we have a lot of people waiting, so I don't want to, we all have a lot of opinions on this and a lot of emotions and opinion, but I want to make sure that we keep things moving here. So we may end up limiting. I want to hear from everybody. Don't get me wrong, but we want to
And
limit the time.
Mr. Chairman, I'll
Okay.
just say that if someone wants to talk with me later offline, whatever, I am very, very happy to meet with them, talk with them in any setting. So.
Okay, go ahead, Senator McKeon.
And I'll make it brief. One last question. So we agree with the science. We want a task force, which would lead me to believe we agree with the CDC and what they're doing for science. If we look at the CDC numbers that they published, if you're over 80 years old, you have a 97.6% chance of survival. And it works its way down the age limits until you're 2 years old and you have a 99.98% chance of survival. And now we're pushing vaccines with a 90 to 95% survival and a 4% death rate. Your own immune system is better than the vaccination itself. And my point is that I wanted to develop a bill that is fluid and not very definitional and puts the onus on all of us. It allows our constituents to talk also and not us to talk down to them and tell them what we're going to do to them. So you believe there's a cause and effect on what we did, and we've kind of passed up the fact that this has probably been around since October or November. So you think what we did is why we were successful instead of herd immunity?
Mr. Chairman, all I can say is if you go into the community, that's the control group. And you can compare the rates of infection and death, transmission, and compare it to within the school system. And you have, and I think that's not, that is a data point right there. That was the one thing we did different. And I think it did make a difference. And the fact that we were able to stick with it depended on the confidence we had in the public and where the orders came from and how they were decided.
Thank you very much. Appreciate you coming to testify. I know you were close by. You didn't have to travel across the state, but thank you for coming to testify. Further testimony, and I would forewarn you, we're going to keep this moving here. So anybody else in the audience here want to testify? Going once, going twice. Let's move to any online commentators. You want to go ahead and let some folks in?
Mr. Chairman, we don't have anyone in the waiting room with their hand raised.
Wow. Okay. I am shocked. Good discussion. If there's no further testimony, we will close this to public testimony. Would somebody on the committee like to do something with the bill? Bill moved by Senator Hutchings. Let's talk about the bill. Any comments on the bill? Senator Furphy, go ahead, sir.
Thank you, Mr. Chairman. Well, first of all, I'm very much in favor of after 30 days of a health order being issued that we have legislative oversight. My concern in this bill is we're restricting the state health officer and the county health officers from taking immediate action when they need to. So I'm going to vote no on this bill because of that. But once again, I'm particularly concerned when the state shuts down businesses, et cetera, without legislative oversight. And I want to see that happen, but I don't think this bill gets to that. So that's the reason I'm voting no. And thank you, Mr. Chairman.
Thank you, Senator Furphy. Furphy, I can't speak. Anybody else wish to comment on the bill? I have a couple comments that somewhere early in this conversation, we talked about, we're looking at this through the lens of the pandemic, through COVID-19 lens. Floods do incorporate public health, as a matter of fact. The water systems, fires incorporate, there's a number of instances where public health is called in. Thank you. That being the case, we tend to look at a lot of things through the pandemic lens right now, and that kind of scares me. I think we make a lot of decisions based on the COVID lens. There's a lot of decisions to be made. As some of you may or may not know, I'm involved in both ends of this. I mean, I'm in the medical world, which we've seen one view of this, and I also am a private business owner, which we've seen another end of this, and we've suffered greatly and are still suffering in both worlds, actually. I will probably be a no on the bill, but I think this is a conversation that needs to be had. Perhaps the other bill that was mentioned earlier is the answer, perhaps not. There's many pieces of legislation that are pending right now in both houses, more in the other house than in ours. But obviously, this is a conversation that needs to be had. We didn't do everything right. You know, it wasn't perfect. I'm also in the fire world. And one of the things we do after a fire is we sit down and we take a look after the fire. We have a tailgate and we say, okay, Captain Fred, what did you see that went wrong? What did you see that went right? And we don't make changes right there, but we do make changes down the road. And that's the way we do that. And I think that's a good means of doing this. But I think it's a conversation that has, obviously, with the number of bills that are out there, including this one, it's a conversation that people want to have. It's a conversation that our constituents want us to have and to do something with. So although I'm a no on the bill, I think that this is an important vehicle and I think it's an important conversation. One thing that the COVID pandemic has done to us is it's made a number of knowledgeable people. We don't need a medical school in the state of Wyoming because we've made a lot of experts through this. Everybody's an expert on infectious disease now. Everybody's an expert on statistics, and frankly, we all make mistakes, and everybody's done a little bit wrong. But this has been a very educational experience for us. So, with that said, are there further comments on the bill or what we have before us, committee? Senator Bouchard, go ahead, sir.
Mr. Chairman, I just want to talk about, we come back to the flooding thing. I mean, it's very easy to say that the water is contaminated, don't drink the water. That isn't the same kind of scenario that we're facing. And so I kind of think it's just unfair that we would give that analogy, the comparison with what a health department does at the county level. Because there are things that are immediate. I mean, there could be a overpass that collapses and it has to be handled with immediately as a situation for safety. That's not what we're talking about here. We're talking about things that go on to a scope of power that go way beyond the science. So I'm in support of this bill. I think we need to move it forward and get it to the floor and have more debate.
Further conversation, Senator McEwen, go ahead, sir.
I'll close out with one last comment. This is truly aimed at public health orders. And I'm not sure I've ever seen a situation where we've determined there was an infectious disease in the first 48 hours. And there may well have been. I just don't have any on the back of my mind. In fact, most of them have taken months before we knew there was a serious problem. Thank you.
Without further comments, let's go ahead and take a roll, Mike.
This is roll call vote for Senate File 80. Senator Bouchard.
Aye.
Senator Furphy.
No.
Senator Hutchings.
Senator Hutchings left an aye by proxy.
Senator McCune.
Aye.
Chairman Baldwin.
No.
The vote is 3 ayes and 2 noes.
Thank you. That bill passes and will be on the floor. Senator McEwen, you get to star one more time. Okay, we're going to pause for 1 second here while we get the next presenter of the bill into the room. He's next door and will be coming to us. And that bill that we will be hearing is Senate File 109, the Board of Dental Examiners Amendments. Thank you, all those that testified. Wave on your way out. Good job. It's amazing how the room can empty so quickly on one bill. Yeah. Everybody doesn't want to talk about dentists.
Unfortunately, we haven't had any.
I see Senator Cooper coming now. This will be, I believe, Senator Cooper's first presentation in front of a committee. So try not to make him too nervous. I know you did great, Senator McEwen. Senator Cooper, take the seat of honor, sir. Welcome to Labor and Health, the friendliest committee in the Senate, for the most part. Senator Cooper is going to present to us Senate File 109, Board of Dental Examiners Amendments. Introduce yourself and let her rip.
Thank you, Mr. Chair. Ed Cooper, Senator from Senate District 20. I'm before you today with Senate File 109. Senate File 109 was brought to us by the Wyoming Board of Dental, Wyoming Dental Board. And what they're asking us for is amendments to their licensing and qualification examinations procedures to bring our Wyoming procedures up to par with the national procedures just for continuity across the country. So it's a pretty simple thing. They've changed language on a few pages. It's pretty straightforward. On page 2, they've added a few words on line 14 and 15 and deleted everything on 16 through 23. And again, it's all just to bring this language into confirmation with the national standards. Page 3, the same things. You'll see some additions of words and deletions just to change the language in line 2, line 3, 7, 8, and so forth on down through the whole thing. There's no change to policy really anywhere. Probably the most significant changes are changes in the dates of renewal. Formerly, it was 3 months after the end of the year that it expired. They're changing that from 3 months to 3 months from the date of expiration is when the application would need to be resubmitted. It also affects, besides the dentist, it affects dental hygienists. Their licensing would be similar and subject to the same rules changes. So that's pretty much the whole bill. It's pretty straightforward. It's a simple change of language to bring us into confirmation with national standards.
Thank you, Senator Cooper. And I noticed reading through this, and perhaps Senator Bouchard recall some of these things that we've listened to. This is pretty common that these boards change their testing. They change it used to be a practical hands-on once a year written, and they did it in 2 parts, et cetera, et cetera. Bills like this open up where they can do that more to what's current because these tests change as time goes on. And we're putting more of that responsibility in the board. The other thing I noticed in reading through here is that they were doing yearly reaffirmations of their license, and this takes it to 2.
To 2 years, yes, sir.
To every 2 years, and that's important. And this is a pretty common kind of bill we see. It's more of a cleanup bill than anything. We're becoming current with national standards with the dentist board. A pretty common kind of bill that we see. It seems pretty straightforward. Does anybody on the committee have any questions for Senator Cooper? Senator Furphy, go ahead.
Thank you, Mr. Chairman. Just a very simple question. On page 2, you're eliminating the examination based on the American Dental Association and the Wyoming Dental Practice Act. is that just assumed that the applicant will pass those examinations where you say it's determined by rule of the board? I just want to confirm that. Thank you.
Senator Cooper.
The applicant shall pass a written and practical clinical and state examination as determined by rule of the board is what it changed it to. Yes, sir. So that would have to assume that it has to pass that is my reading, that they would have to pass that examination prior.
And I would add to that, and this is similar to my own board, is that they're with the same board they've been with for years and years. They're trying to make a change to another board that does their certifications, but in the end, they're all under one. In this case, the American Dental Association. In my case, the American Academy of Physician Assistants. But their certifying group that actually does the test can change from time to time as long as it falls under that American Dental Association. But the certifying exam may change from time to time, but as long as the board certifies, that board says, yes, this is what we're using currently, or we're using maybe more than one, but the board does certify. So that's the bottom line. And that's one of my personal goals, is to put a little bit of power into these boards to be able to do their job a little more. We get an awful lot of things before this committee, or probably things that the boards should be doing that we probably shouldn't be sticking our nose in. Some things we need to stick our nose in more, don't get me wrong. But in this is a case where the board should be making that decision. They're the experts. But did that answer your question, Senator Furphy? Further questions for Senator Cooper? None. You're off the hook, Senator Cooper. Hang around. We may have more for you.
Thank you, Mr. Chair.
Do we have anybody in virtual land who wishes to testify today on this bill?
Mr. Chairman, we do have an individual in the waiting room I will promote to panelist. She's part of the Board of Dental Examiners.
Great. And there she is, but I can't read her name. Would you please introduce yourself and address the committee?
Yes, Mr. Chairman, my name is Emily Crombaugh. I'm the Executive Director for the Wyoming Board of Dental Examiners. I'm here if you have any questions, or I can help address Senator Furphy's question if you'd like.
Go ahead and address that question if you would like.
Thank you, Mr. Chairman. Senator Furphy, the board is still hoping to keep the national examination administered by the American Dental Association. What prompted this change was that they are changing the name of that exam. So they'll no longer offer Part 1 and Part 2 of the National Board of Dental Examiners, but instead will have an integrated National Board of Dental Examiners examination. So this change is intended to still require the exact same exam, but be able to adopt the current change of that.
Thank you. I got the question addressed. Any further questions? She's smiling. We got to have at least one more question. What prompted the change, if you may, from the 1 year to a 2-year certification?
Mr. Chairman, part of that was prompted by the recent opioid CE requirement, which requires 3 hours of continuing ed every 2 years. It's a bit confusing for those on an annual renewal cycle to be maintaining CE outside of that same renewal cycle. Additionally, most of the association members of both the Dental and Dental Hygiene Association are in support of a change to 2 years. So that was that reasoning.
We appreciate that, and I will take part of the blame for the opioid education, the credit or blame, whichever you wish to call that. That was last year. Was that not last year, Senator Bouchard? I believe 2 years ago. I don't know, time flies when you're having fun. Any further questions for the presenter? Thank you very much for coming in and shining the room with your smile. We appreciate that.
Thank you.
Any further presenters in the room? Inland, we got one more here.
Mr. Chairman, Nick Agopian, I represent the Wyoming Dental Association. Thank you today for having the hearing on this bill. Thank you to Senator Cooper for bringing this bill forward to the committee. It did come about from working with Mrs. Cronbaugh at the Board of Dental Examiners, and we feel very fortunate that we have a close relationship working with them. The dentists do support passage of this bill and giving the board the authority to take control over testing without legislative action. Thank you.
Thank you. Any questions for Nick? No questions. Thank you very much for coming to present. Any further presenters, questions, comments? We already decided there were no good jokes present. Anybody else in virtual land who wishes to address us?
Mr. Chairman, that's it.
Very good. Committee, what would you like to do with this bill?
Move approval.
Moved by Senator Furphy. Any comments on the bill? Any amendments, suggestions, change? Nothing. Let's go ahead and take roll on the bill, please.
I do have a joke.
A joke. Wait, hold the roll call. Let's have a joke.
I support this bill because I certainly wouldn't go to a dentist who would lose everything he knows within 1 year.
I like that. I like that. Getting comments out of this committee is like pulling teeth. Okay. Oh, Senator Bouchard.
Yeah, Mr. Chairman, I would just like to make a comment that I think that we've paved a lot of way to move to national standards and other issues. And I think, so this one we can hold up as one of the first ones that we got there without jumping over so many hurdles. So I think it's a trend that we should follow all across all the boards that we work with. Because, and you know as well as I do, we've paved a lot of way on this on other boards. So anyway, so I support the bill. Good thing. Good thing that we're doing this.
Feels good when the road's smoother, doesn't it?
It sure does.
Yes. Okay, let's go ahead and take the roll, Mike.
Again, this is for Senate File 109. Senator Bouchard.
Aye.
Senator Furphy.
Aye.
Senator Hutchins.
Oh, she left an aye vote.
Okay. Senator McCune.
Aye.
Chairman Baldwin.
Aye.
That's a do pass with 5 votes, 5 ayes.
Thank you very much, committee. That terminates our work for the day. Now, if you've looked ahead to the schedule, I gave all of you that note yesterday. The schedule gets tougher. On Friday, we have 3 bills before us. At least one of those has a lot of testimony that I've heard for now. And 2 other bills. Likewise, on Monday, we have 3 bills. So we're not going to get pressed for time, but we're going to have to work a little bit harder. So thank you for your work. We'll see you upstairs.